The numbers are sobering. 1 in 5 children between the ages of 5 and 17 have a diagnosable mental health disorder.
Of even greater concern, the vast majority are not receiving any treatment. Now there is a call to change that. News 3 reporter Dave DeLozier is in the news center with more on what that change would look like.
Yeah, Eric and Michelle, it would be a fundamental change that would put mental health care professionals directly into our schools. It would take services these children need directly to them.
It's more prevalent than people think.
It is a problem that knows no socio or racial boundaries.
National research shows that 1 out of every 5 kids has a mental health disorder.
And of greater concern is 80% are not getting the treatment they need.
Like any illness, when something goes untreated, it worsens.
The repercussions can be seen in our schools.
Well, many of these kids have escalated behaviors. They end up with truancy, suspensions, behavioral problems. Many of them resort to bullying and depression. In the extreme situations, there are links to violence.
And that is when it gets public attention. There have been 74 school shootings since 26 people were killed at Sandy Hook Elementary School. While the cost to provide school-based mental health services is high, not providing it is higher.
I would say we can't afford not to do it. I think it's one of those things that it's a long-term investment that saves us money in the long run.
Because we have disproportionate numbers of kids who really end up in corrections, which costs us more money in the long run anyway. So to me, this is like the best prevention model that you could have. 6
years ago, Fox Cities began offering school-based mental health services. In the years since, they've seen academic and behavior improvements and a decrease in suicides, which is why the Johnson Foundation believes other school districts should take a long, hard look at this.
I think the timing is right and the urgency is really clear because so many kids are struggling and families are frustrated, and even providers and teachers and educators are frustrated too, and so something has to be done in order to improve the situation.
The challenge, obviously, is how do you pay for this? Well, Fox Cities has been able to get financial support from the United Way and other grants. Perhaps the model in all of this, though, is the state of Minnesota, where school-based mental health services are mandated.
Perhaps just a start to cure what is such an important issue these days. Dave DeLozier reporting. Dave, thank you so much.
You bet.